A lot of my friends have called me an inspiration. I don't think I'm an inspiration by any means. What I do know is that I need to keep my positive attitude so my team members know that they can cry behind closed doors, but they can't cry in front of my face. Hi, my name is Shelly Smoke. I've been a pancreatic cancer survivor for about 20 months now. Went to the doctors. They immediately had me go to the emergency room where the CT scan was performed, and I was notified that I had a tumor or mass on my pancreas.
My name is Pezzulo. I'm a 10-year pancreatic cancer survivor. I had no symptoms at all. I had kidney stones, and they found something on the x-ray, and within 2 days my doctor called me up instead and said to come in, and he wanted me to go see a specialist, possibly that I had pancreatic cancer.
My name is Mark Kokanovich, and it's 16 years. February 2004 is when I started the journey. I had no pain. I had no anything that caused me to think I had anything wrong with me. I was actually out of town at a volleyball tournament with my youngest daughter and got up to shave one morning and noticed the whites of my eyes were yellow. I guess I didn't let the pancreatic cancer define me from the very beginning of the diagnosis. I'm not a rear view mirror kind of person at all. And I do remember very clearly that right from the beginning, I focused totally on what I had to do each day to get healthy.
My name is Vivek Cole, and I'm a gastroenterologist at the University of Rochester. I've had a very deep and personal relationship with pancreatic cancer. My father passed away at a relatively young age from the disease. And so as a caregiver for him and also as a young medical professional at the time, I got to see both sides of the discussion, and obviously that left a huge impact on me.
I think my impact is just coming now and like telling my side of the story. It's just, bringing that, awareness. There's no early diagnosis. There's no, breast cancer, you can have the mammogram or, like colonoscopies, and you have blood tests that show other things, but nothing that necessarily can provide an early detection for pancreatic cancer. Despite
the deathly nature of this disease, the overall funding for pancreatic cancer is relatively low compared to some of the other cancers, even though the number of cases diagnosed on an annual basis has gone up steadily.
I had a lot of complications. My pancreas was more on the healthier side than most pancreatic cancer people, so it was harder for the surgeon to stitch up the pancreas, and so I had a lot of difficulties.
With most cancers, we're getting better at it, but this one is still one that's a bit of a conundrum, I think, even when you talk to the researchers. And we have some tremendous research capability around pancreatic cancer and other GI cancers right here in Rochester. And they are making advancements and things are improving, but it's just a very slow go.
Pancreatic cancer needs support for people. The research find ways to detect pancreatic cancer earlier. It's very important that people get involved.
One should not think that I'm only one person, but I think armies are built by adding individual soldiers. So I think the same concept applies here as well. By supporting research and efforts at advancing our understanding of this disease, they can still make a difference in improving the lot of those patients and that of future patients in the times to come. Any medical research cannot really thrive on federal funding alone. All of us have a duty and a responsibility to support cancer research in general.
We need a cure because I'm too young. I'm 52 years old. I've got so many more years of things to do. I would say grandchildren, but my son's not going to give me any of those. But it's like me and thousands of others are looking for that rest of our lives and not to have it end too soon.
So I would encourage anybody that thinks they have a little something a little off to get that checked out. And then if you can help in any way, if you can make a donation, I would encourage folks to please do all we can. The thing about cancer, the statistics are clear. You don't meet anybody that doesn't have cancer in their family someplace. So anything that any of us can do to advance that cause helps the entirety of all of us.
Being a survivor and knowing people that you know that have not survived it is probably the hardest thing for me to go through. said, really, I beat the odds. And they didn't get a chance.